Thank you for joining us for this community briefing. I'm Pat Lopez, the Health Director of Lincoln Lancaster County Health Department, for those of you who don't know me. Joining me again today is interpreter Margie Prop. Thank you, Margie, for being with us. As you know, the mayor usually leads these briefings about COVID-19. She is fine, but she is attending some family obligations today, and we're happy for her to be able to be with her family. For more detailed information about COVID-19 and the resources available to residents and businesses during the pandemic, please visit our website, covid19.lincoln.ne.gov. There you will find a dashboard with the latest COVID-19 data. We update the dashboard daily at about this time, and it's in process right now. Today in Lincoln and Lancaster County, an additional 105 individuals have tested positive for COVID-19. The total number of lab-confirmed cases is now 6,746 in our community. Our total recoveries identified to date are now up to 2,634. At our website, you will also find our COVID-19 risk dial, a color-coded tool that communicates the risk level for COVID-19 transmission in Lincoln and Lancaster County. We update the dial every Friday, and for the 5th consecutive week, the dial remains in the mid-orange range. Orange indicates that the risk of COVID-19 transmission is high. The health department uses local information about what is currently happening in the community and 3 weeks of data in 5 primary areas to determine the risk of COVID-19 to the public. So far this week, we have a total of 388 new cases. For the week of September 26th, we had 571 new cases reported, up from 539 the week before. In August and September, over 3,400 people have tested positive for COVID locally. This is over 50% of all cases reported since the beginning of the pandemic. We are all tired of how this has disrupted our lives, but we have a critical time just ahead. It's important. In addition to the start of flu season, we know that the cold weather will move people indoors, which is harder to distance ourselves from others. We can't move past this pandemic until we stop the virus from spreading. The 7-day rolling average also shows the rapid increase in daily cases we saw earlier in September. This average was about 100 cases a day 2 weeks ago. The daily average has now leveled off into the low 80s. The average weekly positivity rate remains high at about 14.5%. This is a strong indicator that the virus is widespread in the community and the risk of spread is high. As of today, 78,000 people have been tested in Lancaster County, and testing remains widely available in the community. About 3,900 people were tested last week, and so far this week, about 2,700 people have been tested. The turnaround time for receiving test results has been improving. Over the past 2 weeks, the average turnaround time has decreased from 3.4 days down to about 2.7 days last week. So far this week, about 67% of all our lab results have been received in under 3 days. The sooner the lab reports are received, the sooner we can begin the important steps of investigating and contact tracing. These steps are crucial in helping identify and control community spread and outbreaks like the one associated with the September 11th Eagles Club event. Contact tracing requires the public's cooperation. If people are not cooperative with the public health nurses doing the contact tracing, it puts others at greater risk. The nurses are unable to connect cases and notify others that they may have been exposed. They are not given the guidance on how to prevent the further spread. Unfortunately, we have now identified at least 18 positive cases associated with the Eagles Club outbreak. 5 of those individuals are hospitalized. Most of the 75 people who attended this event were older adults, and too many of them became very ill. This spread among previously healthy older adults and their families and friends is a new trend and one that is very concerning to us. The shift in community spread to multiple age groups is impacting workplaces and now hospitals. The number of COVID-19 patients in Lincoln hospitals has continued to trend alarmingly high the past few weeks. On September 18th, just 2 weeks ago, we had 14 people hospitalized. Today, 68 patients are hospitalized with 10 on ventilators. 40 of these patients are Lancaster County residents and 28 are outside the county. Hospitalization is a lagging indicator. When we see an increase in cases, we can expect to see an increase in hospitalizations about 2 to 3 weeks later. On this chart, the orange vertical bars indicate the number of weekly cases. The blue shaded area represents the number of hospitalizations of Lancaster County residents. You can see the increase in weekly cases from 176 in late August to 694 in mid-September. The following 2 weeks, the case numbers leveled off at 539 and 571. Then we saw the number of local hospitalizations increase rapidly. Again, the position of the risk dial is determined by current local information and multiple data indicators from the previous 3 weeks. This map shows how those metrics are plotted in the color-coded risk areas. Toward the bottom left, you will see the testing availability is near green. Towards the middle, you will find the ICU availability, testing turnaround time, and contact tracing is in yellow. Toward the upper right, we see that most of the remaining metrics are in the mid-orange area. But cases are elevated orange and average daily hospitalizations is in the red. You will find the location of the risk dial represented by the blue square outlined in red near the mid-orange section, but just slightly higher than last week. While the dial remains in mid-orange, it is now right on the border of elevated orange. We are very concerned about the high number of cases and the increase in hospitalization. Again, with flu season and colder weather coming soon, we must act now if we want to slow the spread of COVID-19 in our community. We must recommit ourselves to taking the necessary precautions and reducing our social interaction and exposure to others outside your home. To control spread, we don't have to completely stop doing all activities. The reality is you can reduce levels of community transmission if you follow some common sense guidelines. A good example is our local bars. Most have remained in compliance, and most bars are making sure that people wear masks, sit down at tables, and keep group sizes of 8 or less. We truly appreciate their efforts, and their cooperation of their customers is really critical for them. During our compliance checks, the health department has found several situations where past progress has begun to lapse. We want all bar owners to be aware that directed health measure compliance checks will continue. Health department staff and Lincoln Police Department officers will conduct joint compliance visits this weekend. And if significant violations are identified, citations may be issued. Like most things in 2020, fall looks and feels different this year. But with a little planning and caution, we can all enjoy some of fall's signature activities like Halloween and tailgating. We have had many calls about how to celebrate Halloween safely, and that's a great sign that most people want to keep this a safe and fun holiday. Our recommendations focus on simple, common sense strategies. First, anyone who's sick, please stay home. Secondly, avoid large gatherings and indoor parties. Third, don't forget the 3 W's. Wear a cloth mask covering your nose and mouth, watch your distance, staying at least 6 feet from others, and wash your hands regularly. For trick-or-treating, keep trick-or-treat groups to 1 or 2 households, 8 people or less. Avoid clustering at doorsteps or anywhere else. Only visit neighbors that have safety measures in place. Don't eat candy while out. Wait until you get home to inspect the candy and wash your hands, as we say every year. For those handing out treats, Do not hand out candy if you're feeling sick. Wear a mask covering your nose and mouth. Put the treats in prepackaged bags and don't allow children to reach into the treat bowl. Get creative with physical distancing in mind. Stay on the porch and line up treat bags or create a PVC candy chute that we've seen shown on TV a few times. You can find more safety information and tips at covid19.lincoln.ne.gov. We know many of you are also excited for the Big Ten football that will be played this fall. Extensive safety measures being put into place protect the health of players, coaches, and team personnel. Fans also need to plan ahead to safely enjoy the games. The safest way to have a great time is to watch the games with those that live in your household. We are also compiling a list of tips and recommendations for safe tailgating, and we'll be posting those online next week. The Health Department and other city agencies continue to work with our business community to develop safety protocols to ensure that our businesses and the public can enjoy game days. Of course, this will include wearing masks, observing physical distancing, and washing our hands frequently. Now an update on flu. As we mentioned, flu season is upon us. In a typical flu season, less than half Americans get a flu shot, putting themselves and their loved ones at risk of preventable disease. While it's not possible to say with certainty what will happen this fall and winter, the Center for Disease Control believes it's likely that the flu virus and the virus that causes COVID-19 will both be spreading. This means getting a flu vaccine will be more important than ever to better protect yourself, your family, and your friends. The Health Department has formed a vaccine advisory group made up of physicians, long-term care, and aging services representatives. The entire healthcare community is encouraging people to get a flu vaccination before Halloween. Vaccines are now available throughout the community at your physician's offices, local pharmacies, and many workplaces. The Health Department is offering flu vaccine for anyone in the community 6 months and older. An appointment is required. You can schedule that by calling 402-441-8065 anytime between 8 and 4, Monday through Friday. The Health Department also has scheduled flu vaccine clinics at 3 Lincoln Public School middle schools, Park, Leffler, and Goodrich. You will find more information on these clinics and how flu vaccinations in general at the Health Department website, health.lincoln.ne.gov. Many of those sites at the middle schools are next week, and that schedule will be posted on the website. And we encourage those in the neighborhood who need a flu vaccine to go to the site, and we will be offering childhood immunizations there as well. Now moving on to positive news. The annual Streets Alive Festival is Sunday. This year it will be a virtual event. And here with more information is Vicki Cockrell with the Partnership for a Healthy Lincoln, the program manager for Streets Alive. Hi, Vicki.
Hi, thank you so much for inviting me to be here to talk about the 10th annual Streets Alive. For those who may not be familiar, Streets Alive is Lincoln's annual outdoor festival that promotes physical fitness, good nutrition, and provides free health and wellness resources to the community. We usually switch neighborhoods every 2 years, and we were planning on being in the South Salt Creek neighborhood this year, but due to COVID and to keep everyone safe, we've moved the event online. So this year, there'll be 3 different parts to Streets Alive online. The first is the interactive online event this upcoming Sunday, October 4th, from 2 to 4:30 p.m. We've put together 2.5 hours of fun interactive fitness classes and sports and cooking demonstrations that anyone can participate in the comfort and safety of their own home. The second part of Streets Alive online is our 2 games we put together to get people out and active in this beautiful fall weather and to explore the community in their neighborhood. The first is a neighborhood scavenger bingo game with 10 different bingo cards to choose from and a chance to win a bike, lock, and helmet from the Bike Kitchen. If people post pictures on social media with hashtag Streets Alive Online, they'll be entered to win one of those bike packages from the Bike Kitchen. The second game we put together is in celebration of the 10th anniversary of Streets Alive. It's a 10,000-mile community challenge. Anyone can log on to the livewellchallenge.com and join this 2020 Streets Alive group and track their miles October 4th through October 10th as they walk, bike, run, skate, however you want to be active in the community. And if we get to 10,000 tracked miles as a community, we will give a $500 mini grant to the neighborhood association of the person with the most tracked miles. And both of those games, the neighborhood scavenger bingo game and the 10,000 mile challenge, go through October 4th through October 10th. And the third and last part of Streets Alive this year is our Community Partners Resources webpage. We've put together over 40 community partners and all of the free health and wellness resources that they provide the community. So you can go to our website, healthylincoln.org/Streets Alive Online to check out all the details about the 10th annual and the first online Streets Alive. Thank you.
Thank you, Vicki. So for more information, just go to the website. So why don't we open up for questions now? Are there any questions from the media?
Hi, Director Riley Johnson from the Journal-Star.
Hi, Riley.
Hi. What effect, if any, do you think the beginning of flu season may have on the ability to understand the spread of COVID, in Lancaster County, if people may be experiencing similar symptoms, and what, I guess, controls are in place to ensure that you guys know whether COVID's, elevated or not as flu begins to spread?
That's a great question. Thanks for asking. We have already initiated our flu surveillance in the community. So we have sentinel sites that we monitor, and also we get influenza reporting, but we monitor these sites to see what the activity looks like. In our discussion today, I was mentioning about our vaccine committee. We're working with our infectious disease consultant and our physicians representing a wide area of specialties in the community, talking about the testing that we'll do for both flu and COVID. Many of you may remember back in March, we were primarily doing flu testing, then COVID testing if the flu test was negative. So we're coming out with recommendations that the medical community will use to do that testing somewhat simultaneously, so that we'll be able to monitor real quickly, since, as you said, Riley, some of the symptoms do appear to be very similar to each other. So we'll be updating you on a regular basis, and we also send out information on a weekly basis to our physicians in the community so they can monitor what's happening in their practices as well as in our health systems.
Director Lopez, this is Bill with 1011. It's good to see you back, first of all. Second, you mentioned contact tracing. Are the nurses getting pushback, and if so, what does that pushback look like?
On occasion we do, Bill, get pushback. Sometimes people don't really want to respond or answer their phone. Some people are concerned about being in quarantine or having to isolate. In general, the people in our community do a great job of responding to us and providing information. But it is really critical. There's been a few times in an investigation process we could have done better had people shared that they had been at certain events or had certain activities. So That's why I brought that up today, because it really is critical. I can tell you that I've had a couple calls from people saying, gosh, our neighbors were at this event and they didn't even tell us, and they're positive, and now they were over at our place and now we're exposed. So I think it's really important for people to realize that all of those things are contributing to our community spread, and why we all have a personal responsibility to do the most we can to protect ourselves, our loved ones, and our friends and neighbors.
Director Lopez, Andrew Ozaki from KETV. It's also good to see you back. I was just wondering, you look good. You made it through this. The president appears to be doing fine and things like that. I mean, how much are you concerned that when people see this, that they think, well, it's not that big a deal, because, the severity of this can be mitigated a lot more now than it was before.
Andrew, that is really not a true statement. We see the variation of all of this. I think I reported, we have 5 people in the hospital from the outbreak at the Eagles Club. And this is not an influenza-like illness. This is not like having the flu. People are ill. I think one of the advantages in talking with my healthcare providers, and some of that is I have been very diligent in being very careful and following all those practices and wearing my mask and washing my hands and keeping my distance. So in fact, that helped me somewhat as I was working through the illness. But make no mistake, it is a difficult illness, and it's very concerning. I've had people that were fine one day, and the next day they are hospitalized with pneumonia. And these are people in their 20s, 30s, and 40s. So it is critical that we do everything we can to protect ourselves. Yes, some people seem maybe on the dosing have a milder impact from the virus, but others become more seriously ill.
What was your experience, if you'd like to share that, as far as, did you go through any complications at all?
I had some, I did very well, actually. And I actually did have a sinus infection that I dealt with. And I had fatigue, fever, and head pain that went on with the virus that really required me to rest and not have some activity for a few days.
Dr. Lopez, do you have any idea kind of how you got it, and or did you learn any lessons from having it versus what you already knew in this pandemic?
Well, Riley, I have no idea where I contracted it. Nobody in my household became sick. I isolated, and my husband quarantined. None of the staff that I have been around at the health department became ill or were ill that I'm aware of. It's possible I was by an asymptomatic person. Talking with some of my healthcare provider friends, it's possible I touched a high-touch surface and maybe touched my eye. And that's how, and I don't think it's any secret that I've been working a lot of long hours and 7 days a week, and probably have my immune system a little run down, so I was probably a good vehicle for that. But that's, I guess, what I'm saying is that I think it's possible, even when we're really diligent, and this virus is virulent, and we really need to take those precautions. Yes, it's very contagious. I think
Dr.
I
Lopez,
answered-
yeah,
I
yeah,
answered your question, Riley.
I believe you did. Separate from all this, are there metrics that your staff look at, maybe in terms of community spread, positivity rate, daily rolling average, that are your targets for when we'll be at a point of relaxing maybe the mask mandate? I mean, is there or is that something where until there's a vaccine, you won't be able to recommend the mask mandate or similar social distancing measures being relaxed or removed?
You know, Riley, that's something that we continuously review, and we talk with our experts across the country and here in the state. But even when we do have a vaccine, we're going to have to see how much time and how available it is to everybody in the public to really get everybody immunized for COVID, for those who desire to receive the vaccine. And so the mask mandate will continuously evaluate where we're at and what changes we can make. Our goal is to get things back to a situation where people can continue to move safely in the community and we mitigate the spread. But for the time being, when you just look at our numbers right now, you know, wearing the mask, washing our hands, and watching our distance are really the key things that we can do to help us keep moving out and about in the community like we are now. Many people are enjoying many of the activities that we normally do, and I want to encourage people to get out and do that, but to do it safely.
Director Lopez, this is Bill again. With, a month and a half ago, we were at 10 hospitalizations in the city. Now we're hovering around that 70 mark. Is there any concern yet about capacity, or is that also why there's such a concern about the pending flu season?
You know, Bill, we are in continuous contact with our hospitals, and right now our capacity remains good, and we will certainly update you if that changes. But this is just a discussion we had with both of our health systems this week, and we're at a good place right now in being able to manage. But we certainly want to decrease the occurrence of hospitalizations. But at this point, we have capacity. And I believe we mentioned before, we do have a surge plan and processes in place should we need to initiate those. And that is not something that's being discussed right now, Bill. Any other questions? Okay, thank you all for joining us today, and thank you for joining forces with all of those who are wearing masks, washing their hands, and watching their distance to protect friends, family, and our neighbors from COVID-19. Together we are greater than this virus, and your concern and care for others will see us through. And thank you to all of those who sent me well wishes and support. It was greatly appreciated. Thank you.